Welcome tonight to the James Clinic, What You Will Not Hear from Your Doctor's webinar. So honored that you took an hour out of your time to join us, and I'm going to get right to it. So one of the things I hear all the time, you can't even imagine the things I hear about supplements. When people are talking to me, everyone kind of has a feeling about how many you should be taking. I have people who, 3 or 4 is way too many. I have people who've got like 60, and I'm trying to tell them to cut down. So the biggest thing I hear is it's just making expensive urine. And so we're going to get into that and some other myth busting tonight. I'm going to leave my screen like this so I can see your messages. If I put the presentation up, I can't see anything. I'm kind of blind for a while. So we're going to roll with this format if that's okay. Maybe. It is. Try this again. Share my screen. There we go. Okay. So is it just expensive urine? So I've heard it all. I've heard doctors tell patients it's toxic, you don't need it. You'll just get it in your food, just eat well, and you're going to be fine. And then the really egregious is it's going to hurt you, and we're going to get into that. Of course, I have patients who are all over the board. I don't want to take it. It's a lot to swallow. I'll just eat better, or I can't afford it, which you're gonna hear my take on that. So, there we go. So, but what does the data say? What does the data say? So 30% of people have at least one deficiency, and this is based on standard levels. So this is not ideal levels that we're dealing with at James Clinic. This is just your standard levels, and we're going to get into why that's important as we go. 20% of people have inadequate vitamin D, 5% are deficient. Can you imagine how many it really is if we go by our goals, which is a level of 60 to 90, or even in patients dealing with cancer where it's 80 to 120. So in iron, you can see one of the more common deficiencies. Potassium, magnesium, I'm going to argue about 80% of people are magnesium deficient, and then iodine, of course. A little bit better with the onset of table salt that's iodine enhanced, but that may not do it for our patients. Does anybody know, drop in the chat, which country has the highest natural iodine intake in their diet? Does anybody know what country that is? I can't see the chat when I'm sharing my screen, so we will come back to that. What country has the highest iodine intake naturally? It's really fascinating. So looking at immune-related nutrients, looking at just the things that have impacted the immune system, you can see the different deficiencies there. 84% of people have a vitamin E deficiency. And again, this is based on standard levels. But what are standard levels? The recommended daily allowance. So the recommended daily allowance comes from this bogus terminology, the intake that meets the needs of 50% of people in a group. What they really mean to say is this is the dose required so that half of people do not have the disease associated with the deficiency. So this is a very low bar we're talking about. So when we're saying, 30 to 40% of people are deficient, probably 80 to 90% of people are not optimized. And that's really what we're looking for in our patients. We don't want you just to be disease-free. We want you to be optimized in all of those. So again, these are not, when someone tells me, oh, I'm getting 4,000% of the recommended daily allowance, yeah, it's still not enough, maybe. So the RDA, again, minimum goal, we need to keep in mind too, this is based on a healthy population. Less than 10% of people in the United States, probably around the world, are actually metabolically healthy. So again, different baseline. We're talking about different patients, different needs. Avoiding disease is a low bar. Have you heard of any of these? Rickets? How many people have heard of rickets? How many people have heard of scurvy? Do you remember when the British came over to the United States, one of the limiting factors, they had oranges and citrus fruit because so many people were dying of scurvy because they were gone for such a long time. Beriberi, pellagra. These are barely even taught in medical school anymore. These are not something that we deal with on an ongoing basis, yet people have these diseases because even in our very abundant society where people are eating and don't have food scarcity, we have nutrient scarcity. So just if you look at the symptoms, rickets is a vitamin D deficiency. Again, scurvy, I have people with who have bleeding, easy bleeding and bruising. That can be a sign of a vitamin C deficiency. So, interesting. That is not our bar. I have to be honest, most of us, our diets are atrocious. About 53% of adult calories come from ultra processed foods, and that's even worse in children. So, across the board in the United States, now that may be not be true for you on this call, but in general, if we're considering the population average across the United States, it's pretty bad overall. And I would say, if any of us had to be honest, who has a perfect diet, it probably is 10 to 20% of people on the call tonight. I know some of you are extremely mindful and extremely detail oriented when it comes to what you eat, and kudos to you. For the rest of us, we're still not there yet. We might be better than average, we may be substantially better than average, or doing the therapeutic diet that we need, but still not there yet. Even if your diet is perfect, you are not going to get all the nutrients you need from your food because the nutrient density in our crops has declined. So I'm no farmer, but this gets into how they harvest foods, how they plant the foods. Um, this goes to the superficial planting and using the fields for the same thing over and over and over again. Not to mention the fact that how it's processed. We're using things like glyphosate. We're spraying wheat with things like glyphosate to dry it out at the end. So important. Rising CO2 lowers zinc, iron, protein in grains and legumes. I would argue none of those are super great for you anyway. But even with enough calories, even with somebody, 50 to 75% of the time are good with their diet, you are still going to be nutrient depleted if you do not supplement from a capsule. So I'm always going to be food first to replete and replace. That's always the best way to get your nutrients, but it's almost impossible to do this in a way that excludes supplements altogether. So, what do my patients have to say? What do people tell us when they come in the office? First of all, if you come in and tell me you're taking gummy vitamins, I'm going to probably lose my mind. So, no serious person is taking gummy vitamins or fibers. I'm sorry. That is nonsense. So, those gummies have sugar alcohols and things in them that are so irritating to the stomach, or they have a lot of sugar. This is not something adults should be taking. I'm sorry if you are. That is not an acceptable alternative. So I don't want to take vitamins. Okay, you don't have to. Adults have autonomy. One of the things we fight for at James Clinic is the patient's ability to make their own decisions. And sometimes those are decisions we don't agree with. That is okay. But when you look at what most patients want and what their goals are, not taking supplements is not in alignment with their goals, which is to live a long and healthy life and be full of energy and have optimal physical and mental performance and do really well. So these deficiencies lead to acceleration of diseases. This is probably where we get things like cancers, heart disease, diabetes, might be from nutrient deficiencies. Remember, these nutrients go into our body, they're cofactors, they're helping drive chemical processes. So if you're deficient on one thing, and some of you have heard me say this before, for example, making thyroid hormone or making testosterone. This is like a recipe. It's a chemical reaction. It's like a recipe, like making cookies. If you do not have all the ingredients to make testosterone, guess what? You're not going to make as much testosterone. So if you're deficient on one of those coenzymes, one of those ingredients to make testosterone, you are going to be deficient. So we want to fill your tanks up. We don't want you deficient anywhere. Your body will not have the fuel it needs to do the things it needs to do to participate in repair, replace, and recovery if we do not have our buckets full. If you do not want to take them, that is totally your choice, but it's not going to be in alignment with most people's goals. It's a lot to swallow. And some of you, I know you're on handfuls because I'll get into why that is. But remember, most of us can down a pretty big plate of nachos or that supersized cheeseburger, and we don't say that's a lot to swallow. So what we do is we have a lot of different ways to get those in. We can do small smoothies where we break up capsules and put it in. We can put it in things like applesauce for somebody who's just really having a trouble swallowing and getting choked on those. A lot of these come in liquid forms. So we have alternative ways to get them in if there really is. Some people have a legitimate swallowing issue or trouble with capsules. But as far as just it's a lot, we eat a lot of food. And it's part of that. We need to look at it as part of our diet, part of taking care of our bodies. So I don't let that one go too far for me. I'll eat better. I'm going to make my diet better. Good. You have to do that. That is an essential part of what we do with every single patient. However, you have to do that with the supplements. That is they go hand in hand. And you cannot out supplement a bad diet. So, this is the logic of mainstream medicine is I want to take a statin so I can go eat a steak and a cheeseburger and whatever I want. That is not what this is. You have to eat better, but you're still going to need, maybe you can minimize your supplements. For example, if your omega-3 levels are not optimized, maybe you can eat more fish and get your omega levels up. We're fine with that. That's a better alternative. But you probably will still need to take something. So again, you must eat better. And what I recommend patients do, I'm a huge fan. We are adult learners. We all have to take responsibility for our own actions. So a lot of times, if I don't provide somebody a spoon-fed handout for something, I have all of them. Look behind me. I have handouts and supplements and educational for everything. I like people to take their own initiative. Go on and Google what you're deficient in to see what that list of foods is, and then pick what you like out of that and build your diet around that so you can incorporate the foods that you need to be eating. You know what you're looking for, you know why you're incorporating it into your diet, and there's a plan there. There's synergy there. It's not just getting a passive handout that you're looking at. So what doctors have to say. I don't blame patients because very few doctors are versed in nutrition, in supplementation. One of my stories from COVID, you guys know I was in the ICU before we opened James Clinic, and I would go to different ICUs, and every time I would come in, I would round on a patient and I would increase their vitamin D to 5,000 twice a day. That was the best I could do in the hospital without anybody down my throat. 5,000 twice a day. And every time I came back, it was changed to 400 IUs once a day. 400 IUs once a day is all they dosed hospital patients with during COVID. I was furious. What I found out in New York is I would be there for a week and I would get everyone dialed in. And the week I left, they would stop everything I started. So I have very little patience for doctors who get involved in this discussion without information to back them up. So the first one, and some of you might have heard this yourself, it's toxic. You're going to get a vitamin D overdose. You're going to get toxic on vitamin D. So there's 4 fat soluble vitamins. Those are A, D, K, and E, or DAKE, D-A-K-E, D-A-K-E, DAKE. Those are fat soluble vitamins. So in med school, we didn't learn about a lot of these, but we did learn about fat soluble vitamin toxicity, and it is a real thing. However, I've had people taking our 50,000 IU once a day, and they go into their doctor, and their doctor says, you have to stop taking it immediately. That's a toxic dose. The doctor didn't even check a level. Didn't even bother to check a level and is making just egregious knee-jerk baloney recommendations. So here's I'm going to arm you. When somebody alerts you or alarms you about something, especially if we're doing it, ask a question. If you are so concerned that my vitamin D level is toxic, what symptoms am I watching for? What would tell me I'm toxic? They don't know. What are you testing for to monitor my toxicity? What is your recommendation? They don't know. So let me tell you, vitamin D toxicity, if you get too high, it can pull too much calcium into your bloodstream and it can cause disruptions. I've literally had 1 or 2 patients who had this problem. They both had bone cancers. It was before we were even treating cancer, and neither one of them were taking vitamin D. So you need to ask the question, what are you looking for? What are you doing about it? What should I be doing about it? And if they don't have good answers, then you're going to have to go back to the default and trust us because we've been doing this a minute. So out of thousands of patients I've seen literally 2 or 3 that were toxic. I've seen lots of people with levels over 150 and nobody's had toxicity. There's even a book out of somebody who did 50,000 IUs a day for a year. That's a massive dose. So that's usually your weekly dose. Did that daily for a year. His health was fantastic. So you can have some problems with that, but we know what we're looking for. Most of those patients, we're checking your labs every month anyway. And if we see calcium problems, we're going to address it. So you shouldn't have to worry about that. You don't need it. So you don't need it. So most physicians can't identify the nutrient deficiencies, right? They just want to give you, if you're anxious, they want to give you an SSRI, take this and run. Hey, why don't we check a magnesium level? Um, Most don't even check vitamin D levels. And what's the limiting factor on checking that? Insurance doesn't pay for it that often. So you have to know how to code for it. And we can get a vitamin D level for somewhere around $25 to $50. If you get pegged with Quest or LabCorp because it goes against a deductible, you're looking at $325. So you can get a vitamin D level every day of the week if you want. You just have to pay for it out of pocket. Insurance generally will cover it for perimenopausal, postmenopausal women twice a year, men at least once a year. So we can get those covered if we code them properly. The other thing is most of these doctors are not tracking deficiencies caused by the medications they prescribe. This is huge. And it's coming up. So you'll get it in your food. Again, how many doctors even take the time to ask you what your diet is? How many of them dive into it? How many of them know about anti-inflammatory, autoimmune diets, gluten-free, Mediterranean? Most of them are stuck in eat less, exercise more mode, and they do not even dive into what are you eating, let alone what foods do you need to augment for nutrients. So if this is it, then what's your plan to recheck? If I'm vitamin D deficient, that's just the easy one. What's your plan to recheck? How often? What should I do? What foods should I be eating to get more vitamin D? These are all questions we don't have time to address in a 7-minute visit that you're going to get with us because we're going to be monitoring this stuff. And again, more importantly than what you take are the levels in your body. So vitamin D, somebody tells me you're taking 50,000 IU a day. What's your level? Your level is the most important thing because some people have vitamin D receptor mutations. So they can take as much as they want, or they're not absorbing fat soluble vitamins. So you can take 50,000 twice a week and your level is still 30 or 40. We have to figure that out with the GI testing. So it's not just as straightforward as, do this, take that. This is the one that gets me. And some of you it applies directly to, and some of you may know someone it applies to. I have a number of cancer doctors who tell their patients it will hurt you. If you take vitamins, it will protect the tumor, your chemotherapy will not work, and you will be doing yourself a disservice. The theory on this is that a lot of the cytotoxic chemotherapeutic agents are oxidative treatments. So they're creating an oxidative stress. They're making the body a little bit rusty, so the body reacts and takes care of the tumor. So if we're giving antioxidant drugs, it can theoretically protect and negate that effect. So what do? We do not give glutathione, low-dose vitamin C, or vitamin E to people on cytotoxic chemotherapy. And even more specifically, you only need to avoid it the day before, during, and after chemotherapy. But we just don't do it at all to make it simple because we don't want to do anything that will be harmful. And it's a theoretical thing. So it will hurt you. But they don't tell you it might help you. So first of all, there's a number of patients when they get a cancer diagnosis, the entire world focuses on their cancer, on their tumor markers, their scans, their pathology, and forget there's a whole patient here. That is not the only thing going on. So that's why you need somebody like us looking at the inflammatory markers, the metabolic health piece of it. Do you know how many patients I found that have homocysteine levels ridiculously high because their B vitamins are too low? We have to fix that. How do you think your body can get rid of cancer if you're not optimized across the board, all engines, all cylinders firing? So this was fascinating. And as I was doing research for this, the Sunshine study, adding high dose vitamin D3, which is ridiculous, the high dose, to standard chemo improved progression-free survival versus standard dose in colorectal cancer patients. Vitamin D, can you imagine a vitamin improves outcomes, improve survival? Would anyone here take a vitamin if it improved their survival? Yes, I think so. The next one is this other study looked at post-op digestive tract cancers. So esophageal, colorectal, gastric. No overall survival, but in the people with a baseline of 20 to 40, they did better. Imagine the impact if they optimize these patients to 80 to 120. So everything we're going to look at from here for the next few slides, remember, they're not always tracking levels. They're giving minuscule doses, 2,000 IU a day of vitamin D. Don't even waste your time. I'm basically hitting 5,000 as my minimum, and 10,000 is more of an adequate dose of vitamin D a day for most of the patients that I treat. So, large randomized controlled trials are generally negative because, again, they're looking at one tiny factor in this totally diverse population. If I give you one sip of water a day, do you think it's going to impact your kidney function in 5 years from now? Probably not. But if I make sure you have a gallon of water a day, do you think your kidney function 5 years from now is going to be better, worse, or the same? This is what we're talking about. They're giving tiny doses. They're looking for big outcomes. Of course, the studies are coming back negative. So when you see something even remotely positive, like we just saw in the study in the journals that are owned by Big Pharma, you know that that data had to be so convincingly positive that it got published. I'm a skeptic. So converging evidence for a modest reduction in cancer mortality with daily vitamin D in generally healthy adults. Bolus dosing, no benefit. Baloney. Bolus dosing has great benefit. We have to get our body to get it active. Would you take a 10 to 13% improvement in cancer mortality to take a vitamin D every day? Heck yes, we would. That's better than most chemotherapies. Do you know what chemotherapy overall survival improvement is? 2%. 2% across the board. Google it. So again, we talked about the patients with cancer, those two fairly landmark studies. Effective high dose versus standard vitamin D on progression-free survival. This is that sunshine trial. So look here. So high dose treatment with chemotherapy plus high dose D versus chemo plus standard dose D. This is just increasing the dose. Resulted in a median progression-free survival of 13 months versus 11 months. 2 months progression-free survival. Do you think that's an endpoint that most chemotherapeutic agents are held to? No. 50% tumor reduction at 30 days is what gets a drug approved by the FDA. This is better than most chemotherapeutic agents. So it doesn't sound impressive, but 2 months progression-free survival is huge. Now let's look at the next one. So death occurred in 15% of the vitamin D group, 15% of placebo. In the subgroup of patients with baseline serum between 20 and 40, the 5-year relapse-free survival was 85% versus 71%. 15% relapse-free survival improvement. Do you think that's worth it? It's so easy. And do you know how many oncologists tell their patients, do not take vitamins? Do not take vitamins or you can't be my patient. Read a journal. These are your journals. Read a journal article, please. So here's some other ones. I'm not going to go over all of them, but you've got so overall cancer incidence. You've got these are big studies looking at like does it reduce cancer? Again, these are not optimized, and you have a lot of negative studies on big randomized controlled trials. 13% lower cancer mortality. That's pretty good. Let's see. 10 to 12% reduction in cancer mortality with vitamin D, especially daily regimens. Hey, that's worth talking about. 2022, 2023, 14 randomized controlled trials, overall cancer mortality risk reduction 0.94, daily dosing subgroup 0.88. So 12% reduction in mortality in that group in 2023 published. So there's a mountain of data that supports this. We haven't even talked about vitamin C yet. How many of your doctors have said they're just infusing orange juice into your veins? I literally have heard this from multiple patients. Patients are discouraged from using IV vitamin C in their treatment approach. And I don't want to get too much into the IV stuff. We're focused mostly on oral supplementation today. But IV vitamin C has shown to make chemotherapy work better, help patients tolerate side effects better, improve overall sense of well-being and feeling good, and reducing the side effects. And most doctors tell patients, if you do this, you can't be my patient. So there's a few more slides here. Metastatic pancreatic cancer, IV vitamin C. I believe this came from the University of Iowa just last year. Overall survival 16% versus 8%, or 16 months versus 8 months. Do you think if you were coming to the end, you'd take 8 more months? I probably would. Metastatic colorectal, negative for progression-free survival, but this mutant had progression-free survival with vitamin C. Non-small cell lung cancer, 9.4 versus 5.6 months survival. Hey, 4 months, again, this is better than any chemotherapy that's getting approved these days. Glioblastoma, brain tumors, overall survival 19 months versus 14.6 months. So triple negative breast cancer, again, overall survival 27 versus 18 months, favoring the vitamin C group. So across cancers, vitamin C is not a chemotherapeutic agent. It is not designed to kill cancer, but we're seeing better outcomes. This is published over and over and over again. The reason that it is not favored, this goes back to the 1970s, 1980s. A group did a study looking at IV vitamin C, 10 grams a day in pancreatic cancer patients. They doubled their survival. Mayo Clinic ruined it for the rest of us. They went and repeated the study. They did it on oral vitamin C. You cannot get oral vitamin C to get high enough to be cancer killing. So oral vitamin C has to be paired with IV in order to be successful in this arena. So Mayo Clinic said it didn't matter. It didn't improve survival, and so no one's going to do it from here on out. But they were wrong. They dosed it wrong. They gave the incorrect form of it, so it ruined it for everybody. Again, if a doctor bullies you and says, if you don't do it my way, you can't be my patient, I would say, peace out, Girl Scout, because you may not know everything and you don't have to live with the repercussions of your decisions. I do. So that's just my personal soapbox. No doctor, I never did this to patients when I was a surgeon. If you don't do it my way, I won't do this or I won't do that. Now, I'm sure I did some things that were in their best interest otherwise, but not in something like this. So what supplements do you really need? Let's get back to the heart of the matter. Let's get away from some of those topics. There's three main categories of supplements that you need to be thinking of as you're looking at your routine. So there's the foundational supplements that nearly everyone needs just to fill your buckets up. There's therapeutic supplements and there's corrective supplements. Let's get more specific into that. So the foundational supplements are going to be your multivitamin, magnesium, vitamin D, B complex, and fish oil. So those are the big five. You're going to find those in our foundational stack. This is what we start patients on this. If we didn't do anything else, they would feel so dramatically better just by taking this. Now, my two bonus add-ons are creatine. I'm all about creatine right now, and probiotics. So we want to make sure that gut health is good front and center, but that's your 5 plus 2. This is your foundational stack. Now, not everybody needs to take every one of these every day. I've talked to a lot of you. Sometimes we need to break them up and do one day we do half of the routine and one day we do the other. So maybe there's a way to work this in. The vitamin D can be taken once a week. The fish oil can be done in a liquid. The B complex, maybe 3 days a week. So let's get your buckets filled up, and then it doesn't take as much to maintain them once we have achieved that. So creatine is a naturally occurring compound that comes from amino acids, glycine, arginine, and methionine, mostly stored in your muscles. So this is really good for healthy muscles, healthy brains. There's great data now looking at improvement in cognitive function long term. So I don't know about you, but if I get to live to 95, I'd like my brain to be functioning with me. I'd like to know my own name. I'd like to be actually surfing. So this is going to be really important for healthy brains long term, healthy muscles, and longevity is tied to lower extremity muscle strength. So these are the most important things if you want to live a long and healthy life you have to focus on. It helps regenerate ATP, which is that fuel that makes our body go. If you are working out, if you are bodybuilding like Mike, if you are building muscles, you're going to want to look at 20, 30, 40 grams a day. These are massive doses to build muscle mass. If you're like me, where you just want to be healthy, maybe you're doing some walking, 5 grams a day might be your dose. There was also some interesting information. If you're sleep deprived, raise your hand if you're sleep deprived out there. You don't get enough. 30 to 40 grams of creatine after not sleeping well. So my night shift people, I'm looking at you. It improved their cognitive function as if they had slept all night. So really, really important for brain function short term and long term. Generally safe and healthy people. For my people with some kidney function, we can talk about how much you should be taking. Generally 5 grams a day is going to be good for you too, though. Increased muscle strength, greater lean body mass. How many would like to have greater lean body mass? This is, again, every health metric we have improves with greater lean body mass and less fat. improve performance in high intensity and anaerobic efforts. So my athletes out there, this is what you're going to performance enhancing drug that's totally legal. Creatine resistance has been shown to help counteract muscle loss as you get older. So this is an important thing to remember. And yeah, regional hypertrophy. So therapeutic supplements. So that's your foundational. That's just kind of what everybody should be on just to function well and do well every day. Now we have the therapeutic supplements. This is what we need to treat specific things. So instead of going to your doctor and get a prescription from the pharmacy, we have things we can do. Now, the reason this gets so confusing is because the FDA says I can't make a claim that X vitamin treats Y condition. I can say safe and effective all day long and it doesn't have to be true. But if I tell you, hey, berberine can treat your diabetes, go to FCC jail. So what you have to do when you're looking at supplements, supports healthy glucose means it treats your blood sugar. Supports a healthy microbiome means it's going to treat your gut. So we have specific stacks in our store that we usually prescribe to patients. So for example, if someone has SIBO and we diagnose that through their stool test, we have a stack. And it's a specific probiotic, it's a specific immunoglobulin, it's a specific herbal antimicrobial that we're going to use, and it's an anti-inflammatory. So we put it all together. Some of you are familiar with our cancer stack. It's got our high dose melatonin in it. So these are therapeutic supplements that we're giving for specific treatment indication. We have specific metabolic support, reflux. We even have something for gout. So these are very specific. They're used for specific reasons. These are not going to be in the general population of supplements. So corrective, did you know a lot of the medications that you can get from your doctors are going to cause deficiencies? So oral birth control pills causes all of these deficiencies: B vitamin, folic acid, vitamin C, vitamin E, magnesium, zinc, selenium, and some other things. So I don't know how many of you have been on birth control pills in your lifetime, but I'm guessing nobody checked these levels for you. Some other popular things: proton pump inhibitors. Sorry, this came out small. Statins, CoQ is probably one of the more common ones that we know about because they push statins on everybody. And then we have the Qunol commercials that you hear about CoQ10 deficiency. This is what causes the muscle pain with statins. Diuretics cause lots of minerals. ACE inhibitors, steroids can cause a lot of problems. Antibiotics. One of my favorite, metformin, causes B12 deficiency. Guess what? Diabetes causes neuropathy. Guess what? B12 deficiency causes neuropathy. Guess who checks for B12 deficiency in all of our patients? Yeah, you're not going to get that in mainstream medicine. So they don't even know about it, let alone screen for it in their patients on metformin. So what should you do? Number one, you start a foundational routine. You've got to get your routine. You cannot buy your supplements where you buy your toilet paper. You're going to get crappy results. I'm sorry, that's not going to work for you. You want to get third-party tested, practitioner-grade supplements. You can get them. A lot of chiropractors have good quality. Of course, that's the only thing we carry are these high-quality, proven, tested. We test them on ourselves. We know they work before we share them with you. You want to get labs every 4 to 6 months to test your levels. I get a snapshot for most of my patients. These are labs that are going to be covered by your insurance if that's the route that we're going. We also have micronutrient panels where you can get a serum level and an intracellular level of the vitamins to see not only are we getting in your bloodstream, but is it getting into the cell, or are we losing it somewhere in the middle? You can develop an optimal supplement plan that works for you. Again, some people don't want to swallow pills. They'd rather put it in a smoothie every day. Some people want to take a whole bunch. Some people don't want to take very many. Some people forget. Some people travel. Like, we can help you work around your lifestyle and your preferences to make sure you're taking good quality supplements that are going to be worth your money and worth your time. You should feel different when you take them. If you're buying crap from Walmart that I used to put on a shelf, you're not going to feel better when you take it. So a lot of people tell me, like, when I ask them, if you sleep, do you take melatonin? No, I've already tried it. What did you try? Tried it from the big box store. Like, try it again with a quality and you might have a different outcome. You want to be consistent with what you're taking. So consistency is the key. It doesn't have to be the same every single day, but knowing that you have a daily routine, that you take something every day or on a pattern to optimize, that's what you want. And again, you're going to continue to optimize your diet. You can't out supplement a bad diet. So you can't add berberine to your diet so you can eat pastries. It just doesn't work that way. So takeaways, do you want longevity? Do you want to live a long and healthy life? So any of you that know Dave Asprey, he says, I want to live to be 180. The man takes handfuls of vitamins every day. I'm not that committed to the supplement game. If anything, here's a confession. If anything, I undersell and under recommend vitamins because I personally don't like to take whole handfuls of stuff, but there is a way to get it in, spread it out over the day, take a little bit here, a little bit there. Generally, you want to take it with food. Also, almost everything should be taken with food. So important to remember. Nutrient deficiencies are very widespread, so you don't want that to be your problem, right? If we can get that off the table, we can clear the decks and see what do we really need to focus on. There's a lot of erroneous data on how and when to supplement. If they tell you to avoid vitamins, please run. That is not a doctor you want on your team, I can promise you. So I am going to stop there and let's go to Q&A and let's go to questions. So let me see what we've got here. All right. CoQ10 doesn't work without a statin. That's hilarious. I bet not. All right. Questions, raise your hand if you would like to talk, or I will look at the question box down here. Looks like a few of you have joined, so welcome if you came after the opening bell there. I will just put a plug in for a few more things while you guys are gathering your thoughts and ready. Oh, I do see a question in the box, so thank you for that. If you want to speak, raise your hand and I'll call you up, and otherwise I'll go through the box. So open house this Thursday in our Chesterfield office from 6 to 7:30. We have very big specials. So if you're our patient, bring a friend, and we have huge giveaways. We have a 6-pack of vitamins. We have a 6-month unlimited hyperbaric and 3 months of our wellness concierge. So you're looking at $1,200 to $1,800 of value when you bring a friend with you. That is how you get enrolled in that. So we are launching our wellness concierge, which is for people who want help with hormones, weight loss, specific things. And then make sure you're following us on all the platforms. We do a little bit different things on every different platform. So if you're on any of those platforms, please join us. Instagram, the team's been doing a great job getting really relevant data out there. YouTube, we put all of these more long form education on our YouTube channel. We've got we reference this all the time and go back. We have our private Facebook group. So if you haven't joined the Facebook group, please do. I don't know if anyone's on here that has a link to the Facebook group, but if you look at the James Clinic community, you can just go on Facebook and request to join that, and you will be welcomed right in. So, oh, how to take so you're not getting extra processing ingredients in capsules and tablets. So, okay, what about fish oil, microplastics, and Polka reports of oils going rancid in some of the supplements? Yeah, so that goes to a lot of the manufacturing. The company that does the James Clinic products is all manufactured here in the United States. Everything is made in the functional medicine realm. Everything is made gluten-free, dairy-free, soy-free. Some people with really bad alpha-gal have a little bit of a reaction to the outside of the capsules, which is a methyl cellulose, but otherwise it's pretty minimal for binders. It's pretty minimal for things like that. So again, that practitioner grade supplements is really going to get you where you need to be because there won't be those extra ingredients that don't do anything for you. They're also going to optimize the form of the vitamin and the dosing of the vitamin to get what you need. So great question, Betty. Thank you. NIR exposure for mitochondria and BITD versus vitamin. I get sun and supplements both. Okay. So, okay, near infrared exposure. Okay. So a lot of people tell me I don't take vitamin D in the summer because I'm out in the sun all the time, right? Common thing I hear a lot. So your vitamin D exposure is optimized after about 10 to 15 minutes. And if you're dark complected, like our black friends, they actually have to be in the sun longer to get the same release of the melanin. So 10 to 15 minutes is about all you get. After that, you've got a supplement. We know there's a line that goes across the middle of the United States. The mortality was higher north of that line than south because the vitamin D levels are just lower. We just don't have as much sun. So if you're in Florida, you might get by with that. If you're in Iowa, Missouri, you probably need to take extra. Oh, great question, Dell, what is the start of the process working for you? So you've got two options. You can go online right now. You can email us hello@jamesclinic.com. Can also go on a form on our website, put in your information. We'll get right back with you. So generally under our wellness and our complete concierge, you'll start with a nurse intake. They will oh, thank you, Tam. There's our Facebook group. So please join that Facebook group, whether you're our patient or not. That is a private community for James Clinic. Like a little family, we have conversations in there. It just got going about a month ago. It's been very popular and a good place to ask questions and get to know other people. So starting to work with us, you start with a nurse intake. So you meet with my nurse, Gina. She goes over your history. She builds out your chart. She figures out what records we need to get for you to get ready to see one of our clinicians. Then you'll see one of our clinicians, Kate Schroyer, one of our fantastic nurse practitioners, is on tonight. I didn't see if Sarah was on. She usually is. Sarah Taylor is our PA, and she's probably still with patients actually. So you get started with one of them or with me. We get you in. We then get all the diagnostics ordered. So we do a pretty extensive blood work panel. We're doing stool testing for most of our patients. Then we bring you back for two more appointments. We go over each one in depth. We review what it is, what does it mean, what are we going to do about it, and we build that plan for you. At the end of those first two lab review visits, you pretty much have a 3, 6, and 12-month roadmap. So you know what we're going to retest and how often we're going to retest it. So that's how you get started with us. It's pretty easy peasy. I see some of our team are on here. Mary Eads, she can help you. So that is how you get started with us. Great question. I'm taking supplements to target methylation, detox kidneys, mitochondria, BDNF, and gut. I'm having trouble making it manageable and not too much plus fillers in vitamins. Yeah, I could see where that would be the case. A lot of times, if you're on a bunch of combination supplements, which those can tend to be, you can get duplications. So we can definitely look at your supplement protocol, streamline it, make sure, maybe you get one thing with a bunch of stuff in it and then you get single ingredients from there, but you don't want to duplicate. So you may just be duplicating on that. Tam, thank you for adding that. I appreciate you. EPA, DHA. So I tested about 80 to 90 of vitamin D in blood. Wife had low platelets. Can you help? So I never do EPA only. I do EPA plus DHA in all of the combinations we have. They are built in the ratios that you should be getting. So you don't usually want to do one without the other one. For vitamin D levels, I recommend my patients be somewhere from 60 to 90, unless they're dealing with a cancering process and we're working on terrain, in which case it's 80 to 120. And yes, low platelets, we can help first finding the underlying cause, and papaya leaf extract can sometimes bring those platelet levels up. So a number of things there. So here's some more questions. So I'm going to go through these and I will come back. For kidney stone prone, is vitamin C supplementation dangerous? That is a great question. And my gut answer is no, it is not dangerous. This has been debated in the integrative cancer space, because you can imagine if we're doing high dose vitamin C infusions and people with oxalate stones, there's a theory that calcium oxalate will make kidney stones. I'm assured that there's no increase in that and it's totally safe to do. So we're always cautious, and if anybody has any renal issues, we're going to start slow with those vitamin C infusions. I'm not a huge fan of driving those super high to that 7,500 grams unless we have levels to support that and a track record of kidney function that makes us confident in that. So thank you for that answer, or for that question. Ms. Deanna, how important is the timing of supplements? So the timing is important, but it's also specific to, I don't know what that is. It's specific to you. So magnesium is probably the one thing I get asked about a lot. Some people, magnesium makes them tired. Some people, magnesium helps them focus during the day. So if we're not sure, I start in the middle of the day and you see, does it wake me up or does it put me to sleep? And then move it accordingly. Usually we want vitamin B supplements. Those are activating, those are energy. I put those in the morning. Usually your magnesium, your melatonin, I put in the evening. My terrain patients know we do melatonin in the middle of the day because we want to increase our melatonin when our natural levels are low. So counterintuitive on that. There's a lot of things. It doesn't matter when you take it, just get it in. There's also optimal versus I'm a realist. So if you wanted the optimal timing for fish oil, I would do a gram before lunch and before dinner, your two biggest meals of the day, because it blunts the inflammatory effect of the meal. But I'm a realist. If you can't get it in until 8 o'clock at night, I'm going to take it. So sometimes I'm taking mine at bedtime. So it is important, but I'm a realist and we have to get this in during our day. Okay. Interested in GI mapping. Do you work with patients who live in Florida? Yes, we do. GI mapping, we use a company called Genova. We do their testing. So I don't know if this applies to you, but Medicare patients, Medicare generally pays for one Genova test per year. For the rest of it is around $429. Sometimes insurance can kick in a little bit on that and help us out. Sometimes it doesn't. So um, yeah, so we can definitely help with that. Are there any supplements that help with lupus? So lupus is an inflammatory condition, autoimmune. So again, I would start with the gut and I would work on the gut and I would work on inflammation. And there isn't anybody around that we can't help. A lot of times, even just optimizing vitamin D can make a huge symptomatic improvement, or optimizing nutrient levels. People sleep better at night, they feel better during the day, they have more energy. Oh, and Mary got the last one. Thanks, Mary. Is there a family discount on the monthly charges? Yes, we do have family plans for people with more than one person who wants to join us. We try to be family friendly. Our nurse practitioner and PA both see pediatric patients, so we have a lot of couples that join, and we have a lot of now children joining our practice as well. So very good. I had a kidney stone for several years, and after 3 months on your supplements, I was retested and it was gone. Whew. Wonderful. I love to hear that. So it looks like we are kind of winding down on the questions. Let me see if a couple more dropped in or if we cleared them all. Do you still offer GYN appointments? Yes, we do. Our nurse practitioner and PA, Kate and Sarah, both offer well women visits. That's part of our concierge. So that's going to be part of the complete concierge as well as the wellness. We're happy to see you. Come on over and we'll get those set up for you. For those of you who haven't been into our office in the last 3 months, we've now moved to Chesterfield Valley in St. Louis. We are still in Sheraton, Iowa, my hometown. So those are going to be our two locations for now. And we're not doing the Well Woman yet in Iowa, but if any of you know a nurse practitioner or PA, we are still recruiting for both locations and we would love to have, we're the best of the best. So I need someone to join my A team. So if you know somebody, we're always looking for that. So, oh, Scarlett, can we order supplements for you or do we need to be your patient? You absolutely can order supplements from us. You do not have to be in a concierge plan to do that. We're very proud of our supplements. We've worked hard to build a good routine. So we'd love for you to get your supplements from us. If you join our concierge, we do give a discount to our patients because we want to get the best stuff in their hands for sure. But yes, we've priced them. They're great quality. They're great value. Um, couldn't be happier with what we have. And we have two lines. We have our James Clinic line and we also have JC Elite. So if you have an elite athlete in your family, that high performers, developmental elite athlete student, we have a whole line of supplements designed just for them. So we can cover both of those needs and we would love for you to do that with us. All right. You know what? Um, Oh, yes, Healthy AF is Dr. Farella actually has her own private line as well. So we have a couple of the high performers from her line, and Healthy AF, Angie Farella, is one of them. So it is a beautiful evening. I'm not going to take any more of your time. I appreciate all of you being here tonight. Please, if you're in the area, come Thursday night to our open house. We are 4 years old. James Clinic has survived 4 years. We were born in the midst of COVID and it has turned into something beautiful. I'm proud of. I have a wonderful team that is here to support you and take care of you. And for the patients that have entrusted us, we value you, we care about you, and we celebrate your wins big time all the time. So we hope to see the rest of you. Thanks for being here. Next week, we are going to have a makeup webinar next Monday night for the terrain group. Anyone here is welcome to come. We're going to do a terrain specific topic next week. And then in 2 weeks, we have the James Clinic Elite webinar. That is going to be a very exciting guest. It's going to be a very different vibe from the ones I do. Major Mike Hall, the head of our JC Elite, is going to run that one on the 29th. So a lot coming up. So pretty much every Monday night at 6, just plan to spend it with us and we will value pack your evening. So take care, everyone. Appreciate you and have a great night.